honored to introduce the recipient of the 2021 INPCS Outstanding Contribution Award in Neuropalliative Care, Dr. Christine Ritchie. Dr. Ritchie is Professor of Medicine, the Kenneth L. Miniker Endowed Chair in Geriatrics, and Director of Research for the Division of Palliative Care and Geriatric Medicine at the Massachusetts General Hospital. In 2019, Dr. Ritchie launched the Center for Aging and Serious Illness within the Mongan Institute at MGH. The center serves as an example of interdisciplinary palliative care collaborations among clinicians and researchers who are invested in improving care for people with advanced illness. The center offers tremendous support to junior investigators through the monthly research salon, which includes didactics and works in progress, as well as offers two $50,000 per year pilot grants aimed at improving the well-being of older adults and enhancing the lived experience of those with advanced illness. Dr. Ritchie is a trailblazer within the field of geriatrics and palliative care. Over the course of her career, Dr. Ritchie has built and led palliative care research programs at University of Alabama, University of Kentucky, UCSF, and now MGH. Dr. Ritchie co-chairs the NINR-funded Palliative Care Research Cooperative and directs the Investigator Development Center, which conducts PCRC's annual clinical trials intensive. She is the past president of the American Academy of Hospice and Palliative Medicine, serves as a member of the National Quality Forum Standing Committee for Palliative Care and End-of-Life Care, and co-directs the National Home-Based Primary Care and Palliative Care Consortium. Dr. Ritchie has long-standing funding from NIH and foundations and has authored over 250 publications. Dr. Ritchie is an exceptional mentor, a thoughtful collaborator, and a generous connector. Outside work, she enjoys hiking, reading poetry, and models savoring all the gifts life brings. Dr. Ritchie's talk today is entitled Co-Being, Collaboration, and Contribution.
Thank you, Dr. Vranceanu, for your kind introduction. In academics, and particularly in academic medicine, there often is a culture of individualism, of a pull ourselves up by our bootstraps sentiment. We encourage and nurture mentees to become independent investigators. In fact, the key objective of career development awards is that we do help people become independent investigators, and it's often used as a criteria for promotion. We say it's important for people to have their own identity and to make independent contributions. We talk about the importance of first and senior author publications. And we caution people not to become MPIs too soon or work with their mentors too long for fear people's work won't be differentiated. This individualism and independence, while many times laudable, can lead to hubris and territorialism on one hand, and on the other hand, social isolation and self-doubt. You can probably think of examples of both in others and maybe even in yourself. Individualism can lead to redundancy of efforts. It can undermine team science. It can take the joy out of work and a true sense of community. There is a Sanskrit word, sahabu. It means co-being or co-interbeing. It speaks to a perspective that all things are interconnected. Thich Nhat Hanh uses the flower as an example of co-being or interbeing. He says, a flower cannot be by herself alone. A flower has to interbe with non-flower elements like sunshine. The sunshine is in the flower. The cloud is in the flower, because we know if there is no cloud, there is no rain and no flower can grow. So sunshine, cloud, earth, minerals, many things are found in the flower. So the flower, who might think she is individual and independent from the sun, the cloud, the dirt, and the air, is completely dependent on them and is indeed made up of them. This concept of co-being has imbued research and clinical care for me with new purpose and meaning. The interconnectedness of our work and the interdependence I have with others mean that we are all on this journey together. We don't have to worry alone. We don't have to work alone. We all want better care for our patients. We all have unique and interconnected ideas. My ideas are better when they are fed and nourished by yours. And hopefully your ideas, reflections, and insights are enriched by mine. Collaboration naturally unfolds from co-being. I know that your work only enhances or augments the work I am doing. And better yet, I know that our work together will be better because we are bringing our unique and creative differences to it. In collaboration and through others, we see possibilities, new possibilities. We see new ways to organize reality. We develop new approaches and scientific frameworks. We discover new funding streams. We discern new patterns in our data and find that things are not always the way they initially seemed to us. New relationships set us on new career trajectories that augment and enlarge the work that we have done before. So the vision and mission of the Center for Aging and Serious Illness is anchored in the belief that we are all interconnected, that our work is better when we support each other, and that our impact will ultimately be greater when we encourage each other in our work, share our skills and experiences, and grow together through our mistakes and failures. In our meetings, we help each other with our aims pages and our summary statements. We share research methods and tips that can improve our rigor or decrease our mishaps. It's marvelous to see surgeons learning from psychologists and neurologists learning from physical therapy scientists. There's a joy that emanates out of a shared sense that we are all succeeding if any of us succeed, and we are all struggling if any of us struggle. We often think of contribution as that amazing positive clinical trial that gets published in JAMA or a multi-site study that categorically demonstrates benefit for a large subset of persons with a serious neurologic condition. And those are both very important contributions. I believe our contributions through community and in collaboration with each other are often much more subtle, but perhaps in the overall scheme of things, just as important. Our contributions involve being present to our colleagues, listening and learning from our patients and their caregivers, motivating one clinician or one health system to change the way they think. These contributions interconnect us to each other. They expand our sense of co-being and ultimately can sustain us and anchor us for the larger successes or failures. Thank you for this award, and to all those among you with whom I have the great honor to work and from whom I learn so much.